Hi, I'm Dr. Leila Edwards, Principal and Co-founder of Transformations Institute, where our expertise and mission is to share the theory and practical applications of positive psychology. Today I'd like to talk to you about the fact that the current model of mental health is broken and simply not for purpose. In my vlogs, I want to offer some suggestions as to what we can do about this. My intention is to raise awareness, knowledge and understanding of this topic and to provide practical resources for therapists and their clients and anyone else who's concerned about health and well-being. Now, I've always taken an ethical stance in my professional life, and an important part of this is supporting people in exercising their freedom of choice on the basis of honest and accurate information. Now, firstly, I'm going to say that there is no sound empirical scientific research to prove that the chemical imbalance theory prevalent in psychiatry and general medicine is based on any reliable or impartial evidence. There's been minimal research to back up this widely held belief. In contrast, there's a veritable army of doctors, scientists, pharmacists, writers, journalists, researchers, even filmmakers, all engaged in trying to bring this very important information about the dangers of this model and the risks of the widespread use of psychotropic drugs, such as the so-called antidepressants, to the attention of the general public. Now, their problem is that they're largely ignored by the mainstream media, and to demonstrate this, I'd like to ask you to try the following experiment. Just look back through last year's copies of any daily newspaper and make two lists. One, how many times are minor celebrities, such as the Kardashians, mentioned? And two, how many times are the serious problems with antidepressant medications, such as Prozac or any of the so-called SSRI drugs currently prescribed routinely, how often are they mentioned? Then ask yourself this question: which is more important, useful and practical for me, my family and my friends to know about? Here's another interesting question you can ask. How can a drug that doubles your production of cortisol every time that you take it be good for you? Dr. Anne Blake Tracy points out that when you're literally doubling your cortisol levels on a daily basis, your body is completely deteriorating. I can't think of anything else more damaging to the body or the brain than this huge increase of cortisol. Now, that's because cortisol is the primary stress-inducing hormone, and it works alongside adrenaline in the activation of the flight or fight response. Cortisol raises blood sugar and blood pressure and suppresses the immune system, and long-term exposure to high levels damages the cells in the brain and impairs your ability to learn. A single 30 milligram dose of Prozac will double your cortisol levels. Now, Dr. Tracy goes on to say that she's alarmed at the monster that she and neuroscientist Solomon Snyder created when they discovered the simple binding assay for drug receptors 25 years ago when they were researching antihistamines. Prozac and other antidepressant compounds may also cause cardiovascular problems, especially after long-term use, which has become common practice despite the lack of safety studies. The public is being misinformed about the precision of these drugs when the medical profession oversimplifies their action in the brain and ignores the body as if it exists merely to carry the head around. In short, these molecules of emotion regulate every aspect of our physiology. Dr. Tracy expects support for the new paradigm focused on lifestyle changes such as diet and exercise, which, she said, offer profound, safe and natural mood elevation. She also pointed out that studies show that regular daily exercise is 8 times more effective than antidepressants. Now, the editors of the two most prestigious medical journals in the world gave evidence to the UK parliamentary inquiry into the pharmaceutical industry, and they said that medical journals have devolved into information laundering operations for the pharmaceutical industry. At present, our population is part of a largely unregulated experiment involving poorly investigated new medicines that have been licensed on the basis of insufficient data. Now, I'm personally not anti-drugs and certainly not anti-medicine. I'm very glad that, for example, penicillin exists, and some of the techniques and treatments available nowadays have clearly improved our quality of life. As a great believer in the mind-body connection, when I was unable to regenerate the cartilage in my hips due to sudden onset osteoarthritis in my mid-60s, by mind power and nutrition, I was very pleased to be able to benefit from modern hip replacement surgery. However, drugs today are now developed by gigantic corporations, and they're largely for the purpose of generating vast profits, with a flagrant disregard for health, legality, and even human rights. Now, when investigating the truth about reality, the Buddha's recommended approach was to believe nothing I say, weigh my words like gold, and work out your own salvation. Jesus said that all may know the truth and the truth shall set them free. And in Islam, Surah 2.42 of the Holy Quran says, and do not mix up the truth with falsehood, nor knowingly conceal the truth. If you prefer the secular approach, German atheist philosopher Schopenhauer said, all truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. And third, it's accepted as being self-evident. Now, the good news is that there's an increasing interest amongst the general public and more holistic and health professionals to know the truth and to consider approaches that challenge the current medical model which pathologizes normal human emotions and experience to the extent that eventually the whole of the human race would be diagnosed with some form of mental health condition and need to be medicated in some way. Now we have a rapidly expanding sector of humanistic and integrative practitioners who are willing and able to apply more holistic approaches to health and well-being. And cognitive behavioural therapy, CBT, is one of the best known and accepted modalities with high success rates. CBT is very flexible and it lends itself well to integration with other client-centred therapies. Now, we offer an online intensive UK accredited training in therapy, including CBT, to practitioners who want to add these skills to their therapeutic toolkit. So contact me if you'd like to know more and I'll send you further details.